Welcome everyone. My name is Tori Vandelin with PreventConnect. You're joining us today for the web conference, Bystander Intervention from Research to Practice. PreventConnect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. We have a few objectives today before you hear from our presenters. So first of all, we want to describe the characteristics of successful researcher-practitioner partnership. We have both researchers and practitioners joining us on this call to talk about what they found in the research and how they applied that to their practice together. We want to identify current bystander intervention research outcomes, as well as critique the current research literature on bystander intervention. And finally, we want to identify ways to incorporate this current research into practice and have practices be research informed. So we know that in the Centers for Disease Control and Prevention technical packages for violence prevention, bystander intervention and bystander approaches show up in quite a few different places. So strengthening bystander intervention programs is really crucial to a lot of folks working to prevent sexual and intimate partner violence in all spaces and across the lifespan. So when looking at the sexual violence prevention technical package, we see bystander approaches show up in promoting social norms that protect against violence. When we're looking at preventing intimate partner and domestic violence, we see bystander empowerment and education as part of the engaging influential adults and peers strategy. So we know that bystander intervention has many different strategies that it touches on in many different ways of preventing violence. And finally, with preventing adverse childhood experiences, with child sexual abuse being an adverse childhood experience that is preventable, we again see bystander approaches appearing as an approach within the strategy to promote social norms that protect against violence and adversity. So this approach is so key to a lot of the violence prevention work that folks are doing. And we know that bystander intervention approaches are occurring at many, many sectors. Folks today will talk about how they're showing up on campuses. I know we have quite a few campuses online right now. I know somebody just put in the text chat that they're working with Coaching Boys into Men, folks in the Army or in other Department of Defense branches. So there are a lot of different bystander approaches that go into various sectors too. There's also something to be said for the implications of bystander intervention in our current context. I know we had seen the article on the left side of your screen circulating around a lot about, what does a culture that silences bystanders look like, and what is that impact on the violence that others experience? And we also know that there are folks who are looking at how do you encourage bystander intervention in racist acts. This article on the right talks about it specifically in the workplace, but we know that it happens outside of the workplace as well. So when we're talking about bystander intervention and looking at it from a social norms approach, as the technical packages often do, what are the social norms that we're asking folks to intervene with bystander intervention? We know it's not necessarily always the case that folks are intervening in direct violence, but how are folks intervening in instances where harmful social norms are being upheld, or how are they challenging those harmful social norms through bystander intervention? So we have some really great folks on the web conference today that are prepared to talk about that with you all. And before we introduce our presenters today, we want to hear from you all, and Ashley will paste this question into the text chat. How are you currently implementing bystander intervention strategies? I know we have folks from all sorts of fields, sectors, audiences, parts of the country on the web conference today. So we want to know from you all, how are you implementing bystander intervention? It can look different in so many places and in so many contexts. So we want to know where you're coming from with what you're doing specifically with bystander intervention. So I'm seeing folks responding that they are implementing green dot. Some folks are doing the 3Ds or 4Ds model. Some folks are doing mentors in violence prevention. Looks like there's some community specific bystander training that folks are doing. Again, coaching boys into men. I'm seeing a lot of folks are talking about green dot. Oh, 5Ds. What's the fifth one? Bringing in the bystander, athletes as leaders. Again, making your own curriculum. This is great. So please keep all of these responses coming because we want to know where you all are at with this. So for those who haven't put their bystander intervention experience in the text chat yet, please continue to do so. But we also want to know, we're not just talking about bystander intervention today, but we're also talking about researcher practitioner collaborations. So again, please turn to the text chat and let us know what experiences do you have with researcher practitioner collaborations. And I see Rose gave us an answer to what are the 5Ds, and that is distract, diffuse, distance, delegate, and direct. So that is saved in the text chat for folks who want to see what the 5 are. And I see folks are still talking about the bystander intervention programs that they're doing, safe bar, bringing in the bystander, doing bar outreach. What experiences do you have with researcher practitioner collaborations? So continue to think on that and add it to the text chat. As you're doing that, I am so excited to introduce the presenters on today's web conference. And Rose, I am so sorry. It looked fine until we came on Zoom, and then it just had to rotate your picture. But we'll make sure that's fixed in our final version. But thank you all for joining us on this web conference today. We have Rose Hennessy Garza, who is a postdoctoral fellow. We'll be sharing a lot about the research around bystander intervention. Tajmal will also be talking about how we collect information around bystander intervention programs. And Sarah and Katie will join us towards the end talking about that researcher practitioner collaboration that they've done on their campus. So thank you all. And Rose, I am going to hand it off to you to tell us more about your research.
All right, everyone, welcome. Tori, if you can't hear me, let me know. Otherwise, I'm going to jump into the next slide. And just start by saying that, you know, I've got a lot of information to cover. Luckily, you got the slides handy, and this is also going to be recorded. I'm always willing to answer questions as well, too. So these are the 3 things we're going to cover, and I'm going to go through them kind of in 3 sections as well. You're welcome to answer questions or put in questions as we go through, and depending on, you know, how it fits, we can field them now or later. That'll work well. And before I move forward, on the next slide, I also just want to take a second, if you can move to the next slide for me. Oh, hello, Elizabeth. To say that, you know, I have just one perspective, right? And I come from a really privileged background, and I've been really blessed to be able to do anti-violence work for over a decade. You know, but as I try to show you this research, you know, the goal is to just present to you what has been in the literature and what other researchers truly have found in the next 30 minutes. But obviously, it is impossible to do that without a bias. So I am presenting this in one perspective, and I'm really, really grateful to be on the call with all of you because we need multiple perspectives to really, you know, create a full picture and serve all of our communities, not just some of them. I also want to further say that I'm not endorsing any programs or any specific approaches. I'm not funded in any way to do so. These are things that I found in the literature that I'm going to share. And last but not least, you'll see that there is a link. Becca, thank you so kindly for putting that in the chat for everyone. I have found that it's easier to have all the references in one document. So I've been giving a version of this presentation in a few different places, and I've been adding to this. So if you're like, what was that reference? You know, most of the things, if there's any missing, please let me know and I'll add them. Should be available in APA view in alphabetical order. So with that being said, let's go ahead and jump in. All right, so slide number 1, what do we know about the current effectiveness of bystander programming? On the next slide, you'll see that we have initial evidence to suggest that qualitative studies say really good things are happening as a result of bystander intervention training. Qualitative studies being those that ask for open-ended feedback. So like, write about what you learned or a time that you intervened after going through this training. So that's wonderful news. We also have 3, and really there's 4, because there was one that was published this year that I'm going to mention, meta-analyses that indicate effectiveness of training overall. For a quick overview, a meta-analysis is a great resource for us to use when we're making decisions about evidence, because researchers will go and they will find all the other research articles out there about one topic. They will combine them together, and then they actually calculate a statistic called an effect size. And they're able to tell us how effective across multiple programs things are. So all of these reviews being replicated indicate small to moderate effects on intentions and behaviors. Intentions being, if I come across a situation, I think I'd intervene. Behaviors being, oh, I came across a situation like, you know, witnessing someone who is possibly about to experience sexual assault, and I did something to try to help out. And most of these studies come from college populations. So I want to walk through in the next 3 slides some other findings from these studies as well that might be helpful for you in your programming. So first, Jennifer Katz and colleagues in 2013 published this first meta-analysis, and you can see the 0.49 is kind of like on a moderate effect size, and the 0.23 is smaller. For those about you there who are interested in confidence intervals, that's available too. So that's kind of what we're talking about. Effect sizes range from -1 to 1, but generally with 0. So 0 means no effect, we did not create change in programs. 1 is like, we nailed it, completely effective. So obviously 0.5 kind of in the middle, 0.2 lower. And if you have a negative number between 0 and -1, it means there's an effect in the opposite or inverse direction. So you'll see here too that there was no effect on decreasing perpetration. One of the things we talk about with bystander intervention is how does it prevent violence? We're actually lacking a lot of theories and models to determine the direct link with that, but there's been kind of some theory that, you know, just by being in a bystander program, like, hey, when you're in situations, step up, you know, we're a community, let's do this together, that people who engage in violence themselves, that training alone might be enough to kind of change their own attitudes and keep them from preventing violence. This review found that that was not the case in their measurement. If we go to the next slide, you'll see a more updated review from 2018, and this included double the amount of studies. So that one had 12, this had 24. It's obviously there are many more than 24 studies published, but this met the search criteria, and one of those things generally included control groups and having outcomes at post or follow-up. A control group is really important because we don't just see changes in people who receive a program, we compare them to folks who didn't receive a program, and we have more evidence to suggest that something's effective. So again, you see those small to moderate effects, 0.27, 0.39. Other things that I thought this review helped show us that are interesting, at 3 months follow-up, so someone went through a program, maybe it was 1 session, maybe it was 3 sessions, they were tested, and then 3 months later they were assessed again to measure their attitudes and behaviors. And while there was a little bit of a decrease, we call it an attenuation, at 3 months there was still a significant result of training. So that's really promising news for all of you out there doing this work, because that's like, you know, we do training, we see positive changes, but does it just go away next week? People have a lot of things going on. Do they remember? The other thing that came out of this review is they didn't find any effect of facilitator. So there's always these conversations, right? Like, are bystander programs more effective if they're led by peers? Are they more effective if they're led by professionals? So in this training, they didn't find any significant differences in outcomes based on who that facilitator was. And they also found no differences based on the gender of the audience. So, we heard a lot with like victim risk reduction programs or men's only programs that perhaps it's better to do something in one gender or mixed genders. But here, whether it was all male, all female, or mixed, they didn't find any differences in outcomes. Oh, I tried to move the slides myself. If you can go to the third one for me. So this article came out last year, and it included 14 studies. This one also included high schools or secondary schools. And again, you see that kind of small 0.28 moderate to small effect size. This review also found no effect on perpetration. So 2 reviews finding no effect on that. And other things that I think were helpful from this review is that they found that regardless of how a program was implemented, it didn't change the outcomes. So for all of us who are considering online programming, especially with COVID-19, this might be kind of a promising finding. So whether, again, based on gender, in-person dissemination versus online, they didn't find any significant changes in creating changes in behaviors, attitudes, and intentions. Another conversation that people have is about the framing of bystander programs. Like, should we come at it as this is a women's issue, or women are more likely to be sexually assaulted, or is it better to just say, anyone can be a victim, anyone can be a perpetrator, we should all, get together and rally around creating change. So they actually kind of coded the different articles to see which framework they used, and they called it a gendered framework, and again found no significant impact. So whether programs were presented as a women's issue or neutral, they found the same outcomes. These same authors then published again earlier this year in 2020, where they did another meta-analysis looking at the effects of programming on those like conventional bystander models from like the 1970s. Like, first you have to notice, then you have to take responsibility. So they found that the bystander training programs only had a significant effect on identifying situations that were in need of intervention. So that, that's actually really positive, especially for newly trained or new students that they, we talk about all the time, right? Like, do people even know when they're supposed to intervene, especially for more upscale forms of violence on the continuum? All right, so that's a review of reviews. On to the next slide. I want to talk a little bit more about online programming, just because all of our lives are sort of becoming online in many ways. When we go to the next slide, I want to highlight a few things that I found in the literature. So if you haven't heard about this program, you probably will shortly. It's called Real Consent, and it's kind of like a video game interactive. Again, I've never seen it. I've never been a part of it. This is just from reviewing a research article in last year. And thank you so much, Ashley, for putting the link to that in the chat. So this is modeled after a men's workshop. It's 30 different modules, and it was intended for males. Project funded and evaluated by the CDC. So they did find with a pretty good measurement test that this program decreased perpetration while simultaneously increasing bystander behaviors. So that's really promising findings. They say on their website that they're currently doing a revision of the program. If you want to learn more about it, I've got the site up here. And then they also say that the researcher who's heading this off, you can see her name on the slide, her email is there. And if people are interested in participating in their studies as they're assessing it, that you can reach out to them. And apparently the program will be available soon. So keep your eyes out for that. Next program. that's online. Unlike that one, the real consent that's not available, Intervene, you could watch it right now, but I hope you don't. I hope you stay with us, because I've got folks who are going to talk later that I've gotten to work with who are brilliant. I think we can learn a lot from them. But Intervene is a 20-minute video out of Cornell, and if you clicked on the link right now, like I said, you scroll down, you can see that video. They did a randomized control trial, which is sort of a gold standard in testing interventions, with a sample size of over 1,000. And while they didn't assess behaviors, they did see that this video increased the intentions to intervene at 4 weeks follow-up. They found that it seemed to be a little bit more effective in females. Another positive finding, they had a relatively large sample of graduate students, and they found that they had the same effect whether it was for undergrads or graduates. So that's really nice, especially for those of you who are working with graduate students and want to make sure that your programs might be effective in that population as well. And another nice thing about this video, again, I'm not, whether it's good or bad, I'm just talking about the research itself, is that it involves multiple forms of violence, including racial bias, intimate partner violence, and hazing, and in addition to sexual harassment. And then lastly, this is kind of a fun study. As someone who recently finished a dissertation, I'm celebrating dissertations. This one was published in 2017. And they looked at the effect of using text messaging as a booster after in-person bystander programming. So many of you are probably familiar with the Green Dot program. It's a bystander program traditionally done on college campuses, but also in other settings as well. So they did this study where, they implemented this bystander program on the campus as normal. From people who attended, they invited them to participate in a study, and the participants got to decide if they wanted to be in a control group where they just received surveys to take, or in an intervention group. If they chose to be in an intervention group, they were then assigned to 2 different styles of text messaging. And I'll explain to you what those 2 different styles mean in a second. After this intervention, they received 12 different sets of messages over 14 weeks. And fun fact, it was always Thursdays at 2 p.m. So autonomy versus directive-based. If you go to the next slide, the researcher looking at this said, does it matter in our delivery if we give participants more choice, like they get autonomy over an experience, versus we're more directive and we just provide them that information and say, hey, this is what you should do? So I have 2 examples up here. I also have a link at the very top because this dissertation is open source, which is wonderful. So if you were to go and click on that link right now, in Appendix A, you can see all of the different text messaging that they use instead of just these 2. But you'll see in the first question, what might stop you from intervening in a possible sexual assault? And then there's options like being embarrassed, not knowing when to act, and so forth. So that was considered an autonomous style of text messaging because the participants got to choose one of those, and then they'd get an automated text message back based on what they selected, versus the other intervention group that receives something like embarrassment or not knowing what to do can stop people from intervening. To overcome these barriers, click here. So you can kind of see how that one's more directive because it's sort of just directing people like, we know this is a barrier, click here to learn more. And I think the second one really differentiates it well. Like, are you going out this weekend? Some people find it helpful to think ahead versus are you going out this weekend, plan ahead. So you see that directive language. So what did they find on the next slide? They found that in the combined intervention, so anyone who received a text message that these are the author's words on the left and my reframe of them on the right, that those in that group determined that they had more personal responsibility to intervene. So people who received the text messages felt more like, I should do this when these things are happening. They had higher self-efficacy or confidence, like I'm competent and feel like I can intervene when I face different scenarios. And they also felt more supported by their community. Like the people in my community think it's good for me and support me when I intervene in situations of violence. When we compare the 2 different types of text messaging, in the autonomy-based group, those participants were more happy to have higher frequency of messaging. Like they were more likely to say, hey, that amount of text message is fine with me. And they were more likely to participate. So I think, you know, whether people go out and do text messaging boosters or not, just this kind of idea that students and young people, you know, or older folks on campus as well, might be more likely to want to engage in our programming when we come at an autonomy-based position, I think is a really, you know, positive and probably not too surprising finding. They didn't find any other differences between those groups. And this evidence should be taken with a grain of salt because the participants in the control group did get to self-select into it. But on the flip side, they had all received some bystander programming. So pros and cons. Moving on to the next slide. That is kind of a review of what we know about effectiveness of programs with a little bit of spotlight on text messaging and online programs. So I want to jump into part 2. Remember I said I was going to cover 3 things in 30 minutes and I'm at like 12, so I'm doing all right. Before I jump into this, none of you are going to be surprised to know that we don't know as much as we should. And I think that, you know, I want to spotlight this quote that current research generally suffers from a lack of diversity in the study samples, despite the diversity of most campus communities. So unlike situations where, you know, 99.9% of, you know, a community might be non-Hispanic white, that's not the case on campuses. And yet we're still getting samples that are generally 2/3 to 80% non-Hispanic white and making conclusions broadly. So this is kind of like, hey, researchers, we got to do better. And I'm one of them too. So let's jump into what we do know. It's going to be a little confusing because I'm going to say something and then I'll say something completely the opposite. So there are mixed findings. You know, when I got to share those meta-analyses earlier, that's really nice. I look forward to the day that we have a meta-analysis on bystander outcomes related to race ethnicity. But I am willing to say, tentatively, that initial evidence does suggest that we have some variations in outcomes. Whether those are real or based on measurement error still seems to be determined. Let's jump into the next slide. So this is a great article from 2018, and within this article, they actually talk about 3 different research articles that measured race ethnicity. So I'm going to review them, but I just want to like give props to this author that they did the work. So walking into that first article, I also want to highlight different ways that researchers are measuring outcomes related to race ethnicity. So the first approach is, you know, comparing all white, I'm saying white, but all these studies refer to non-Hispanic white versus other. Obviously, we have huge limitations with lumping all students of color into a category that says other, you know, and it is my hope that we move away from this in the future, including myself as a researcher, that we move into more creative and strategic approaches. What they did find, not super helpful, is that there is variation and it's a little complicated. On the next slide, there's sort of this approach of taking one racial ethnic group and then comparing it to white, non-Hispanic white students. So an example of this is a 2014 study that looked at African American and white students, and they found that African American students had more bystander behavior and fewer missed opportunities. So I need to take a second to talk about what it means to have a missed opportunity, because this is a best emerging practice in bystander intervention. So researchers are now, especially in the last year or two, instead of saying, did you see the situation and did you intervene, questions look more like this. How many times have you heard a racist comment or joke in the last 6 weeks? This is the measurement I used in my last study. And they might say, oh, I heard that 4 times. And then of those 4 times, how many times did you intervene or take some kind of action? Oh, I did that 1 out of the 4 times. If that was the case, they had 3 missed opportunities because they only intervened 1 out of 4 times. And we're starting to use something called a behavior likelihood score, which would say that their likelihood of engaging in that bystander behavior is 0.25, or 1 out of 4 opportunities. So having fewer missed opportunities is actually almost better than having just like more bystander intervention, because it means it's more consistent. If you go to the next slide, you'll also see another finding from this study that they added something called a gender interaction, which this really should be established best practice moving forward in all of the articles that are looking at race ethnicity, because we know gender is such an impactful outcome in bystander outcomes. So they looked at 4 quadrants. White men, white women, African-American men, African-American women. Obviously limiting because they're not including non-gender binary folks. But what they did find within those 4 groups is that white men were the least likely to intervene and African-American women were the most likely to intervene. So you can see how that interaction of putting the gender with the race ethnicity is really critical to get a better picture of how students are experiencing trainings and getting outcomes. Lastly, our third approach is multiple group comparisons. So we'll look at Hispanic to white, we'll look at African American to white. Best practice is also that, white students don't necessarily have to be the main group to compare to. I'm working on a different study right now, and we're doing different Hispanic subgroups in the US, and we're using Mexicans and Mexican Americans as our reference group with Puerto Ricans and Dominicans based on the topic of interest. So the reason that normally happens has to do with statistical reasons, but we might want to consider that that's not always the norm moving forward. In this study, they found that Asian and Pacific Islander students had less intentions to intervene, fewer opportunities, but they had no differences in missed intervention opportunities. So what that means is when they actually experience things, they weren't intervening any differently than any other students. I actually found similar results in a study that I did recently, where there were some differences in intentions, but when it came to behaviors, there were none. And we'll talk about why that might be in an upcoming slide. And here they found that African American and Hispanic students actually reported more missed opportunities. So that first study that I showed you said that they had, less, and here they're saying no. So it's kind of confusing, right? They caveat that it had a lower African American sample. But on the next slide, the author actually kind of replicated that analysis in 2020, and they found the same result, that there were more missed intervention opportunities in African American and Hispanic students compared to whites. Again, all of these things have lower sample sizes, so they have to be taken into consideration when making conclusions. And then lastly, the last study that I want to show about this was the one that was from that article that reviewed those 3 background papers. Here, they found that non-Hispanic white students reported more opportunities to intervene. And they only found one significant difference in bystander behaviors, that Asian American students had less odds of reporting that they did something when hearing rumors that a friend forced someone to have sex. Moving into the next slide. Before I talk about some really important things about measurement and why that might be explaining the differences that we're seeing, I want to mention this program. This article was just published a month or 2 ago in 2020, and it is the first article that I've seen. I'm sure there might be others out there that is specifically focused on a bystander intervention program tailored for the African American community. It's based in liberation theory, and it was implemented at a historically Black college and university. While it was implemented in male-only and mixed-gender groups, they only studied outcomes in males. And if you want to learn more about this, I unfortunately have very limited information. I just had one research article and it's not publicly available, but you would always be welcome to look up the information and contact the author. I don't want to misrepresent any programs or their findings or content either. But I will say that it looks pretty cool just glancing at it. All right, so in the next slide, they did more of a qualitative analysis and a lot more process oriented, which makes sense because it's a new program. So in coding some data, I'm quoting from the abstract that they talked about attitude changes and that a key finding was that for the male participants, identifying ways in which persons had experienced violence in their lives was very critical in helping them change their attitudes, and helped increase empathy. So instead of coming at programming, this is my take from reading the article, as, you know, things happen, let's intervene. It was more about let's reflect on how we've all experienced violence and how we can come together to address that. Another conclusion that they had from the qualitative study was that stopping violence in the community as a community and really taking like a community approach. Bystander intervention normally does that, but even further within like the African American community, we can do this together, seem to be really critical and important to the participants. So let's talk a little bit about what this might mean moving forward, especially with next findings. So I'm willing to say that there might be some variations, especially in opportunities and intentions, and maybe in intentions, it actually seems like there might be less with behaviors, but I'm giving you 5 studies, so we really do need more research before we can make conclusions. Using intersections with gender are critical, or we're going to mask true findings. 3 questions I think might help us understand these studies. How do outcomes vary based on campus demographics? So my advisor had brought this up that, a person of color within an institution that is predominantly white, what does their intervention experience look like compared to a person of color in an institution that is predominantly students of color? And currently research really isn't taking that into account, but especially as we continue to collect data and do intersectional bystander programs that address racism in addition to sexual violence simultaneously, this seems to be a really critical question. 2, how well do these surveys really represent the situations that people are experiencing in real life? So I talked about like opportunities. If survey questions ask, when you go to a party and you see someone who is drunk, what do you do next? Something, something, something. And these are participants who don't go to parties and don't go to drink. This is a classic example. Obviously, they don't have those opportunities. So are the questions themselves viewed towards non-Hispanic white students to whom they, most of the samples were used to create these original scales? I think that we could lean and say possibly yes, and we need measurement that might be more culturally responsive to the experiences of students, not just by racial ethnic groups, which is critical, but also today when we have all of the social distancing, we have new normals, the classic situation of being at a party or seeing someone having too much to drink might be looking really different in different parts of the country and world right now. So considering that in our bystander training itself and in our measurement seems important moving forward. All right, and I think we're going to take a break and do a quick question.
We are. So Rose, I'm going to put up the polling question for this section so folks can start to answer how much of the information that Rose just shared is new to you. And Rose, as folks are answering, there were a couple questions in the text chat that I think now's a good time to ask you. So the first one is there any research out there that does include non-binary folks?
I've heard that there's a one green dot study, and actually Tori and Ashley might be able to talk more about it, that was done with high school students that assessed outcomes, but I don't know if that was more in LGB populations compared to transgender or non-binary. I really have not seen that. It's hard to even find representative data about how much the people are experiencing violence, much less how much the trainings are assisting them. And it really is a huge limitation in this research. If I ever know more, I'll send it to PreventConnect and let them forward it out to all of you. And if anyone else in the audience has, come across something like that, please feel free to share as well.
Yes, please do. And the second question is, can you talk a little more about what you've summarized in the first set of slides that demonstrated that bystander intervention training has no significant impact on decreasing perpetration?
There were two meta-analyses that demonstrated that it was not significant. They have less studies that are using this. I think a really big, important push that we need moving forward is to measure perpetration. It's actually, like, as a researcher, I have experienced more barriers in some ways to trying to measure perpetration compared to victimization, because campuses are, they don't want data that talks about how many people are like perpetrating violence on their campuses. But I'm hoping that, through a lot of education to say, like, having baseline data is important so we can change things, can help us move forward. That being said, there are standalone studies, not a part of meta-analyses, that have demonstrated that effect. Another research study I did maybe 2 years ago, I found that programs that intentionally combine messaging about bystander intervention as well as what I would consider primary prevention, or trying to prevent perpetration, when those messages were combined, they were very likely to meet both goals simultaneously. So that's probably a little bit what that Real Consent program was doing, not knowing their curriculum in depth. I'm assuming they target risk factors for perpetration as well as bystander intervention together. And unfortunately, no, I don't have an example that that's the program that's not currently publicly available yet.
Thank you, Rose. As you were answering those questions, folks were responding to our poll, and you really shared a lot of knowledge that was new to a lot of us today. So thank you, and thank you for making it so easily digestible too. I think it can be a challenge to share high level, complicated research and share it in a way where we're like, yeah, I get that. So just want to thank you for that, and we'll move ahead and talk about measurement.
Let me move this. So I'm going to go through this a little bit quicker because I want to make sure you have time to hear from other folks on the call. I started the first graphic was results moving forward, and I flipped it to moving backwards because, a lot of bystander program measurement has talked about the good, but, we also know that there are unintended side effects as well. So I want to quickly highlight some of the studies that have looked at that. So this article in 2017, you'll notice all of these are really recent. It is a hot time to be doing bystander intervention research. Did actually 2 studies in one that they published. And in the first one, they found that 16% of participants who'd engaged in bystander intervention experienced a negative consequence. In the second study, they found that 1 in 5 had experienced that as well. And I've included the list of consequences, negative consequences that they measured. And these are like big deal things. It's not like I hurt someone's feelings and they didn't talk to me for a day. This is threats, violence, and some sort of serious trouble. Also worth noting that most of the participants who experienced one negative effect also experienced more than one. This next study, I got to give a shout out on the last screen. The author, John Gritch, is the 4th one, was a member of my dissertation committee and is really doing awesome work. So if you ever want to learn more about outcomes and consequences, I recommend that you follow him and learn and, look him up on Google Scholar or wherever to learn more. Okay, next slide. Another article out of 2017, so they provided 19 different bystander scenarios. That is, I heard a racist comment or joke, I heard degrading comments towards women, I witnessed someone who looked like they might experience sexual assault, I saw someone being dragged into a room when they were intoxicated and it looked like they couldn't give consent. Okay, all of whatever those were, but in 19 scenarios. And after kind of creative measurement strategy, they listed each word and then said, did you feel this, yes or no, after intervening? Here's what they found. So compared to those who didn't intervene, students who did were more likely to feel good in all 19 scenarios. So, and these are all statistically significant findings. They were also more likely to feel proud in the majority and empowered in about half of scenarios. Conversely, compared to those who did not, for students who didn't intervene, they were more likely to feel neutral in all 19 events and bad or regretful in over half of them. This study also went further to look at mental health outcomes, and they found that both witnessing and intervening, so I witnessed it and I didn't intervene, I witnessed it and I did intervene, regardless, was associated with an increase in post-traumatic stress symptoms. Not incredibly surprising, because these are some pretty horrific things to experience and witness. I guess kind of a silver lining, they also found that witnessing was associated with having depression symptoms, but not when students intervened. So to summarize that, if I witness something and I do nothing, I'd be more likely to be depressed. If I witness something and I do something, I'm less likely to be depressed. So the authors talk about this as kind of like this bittersweet outcome model, that bystanders feel good, but regardless of what they do, they're still at risk for traumatic stress symptoms. And I think from an intervention perspective, you know, right now in trainings, it looks like this. You should consider your safety as you intervene, period. And that's kind of the end. Maybe there's more happening out there, and I wonder what we could do to support students more as they intervene. If we move into the next study, this one asked, so this is kind of an interesting methodology. They asked people to write an answer, like a paragraph, who had intervened in certain scenarios. And then they took that information and coded it to see if, as the person who had intervened wrote, they indicated that the victim or potential victim had a positive experience to their intervention or negative, if there was a potential perpetrator, if they had a positive or negative experience, and then also whether intervening itself stopped the behavior or not. So this doesn't mean that 30% of victims were positive necessarily. It just means that when the person wrote about it, they included something that was positive. So we take it with a grain of salt, but I think it's still interesting initial evidence. And this was also a 90% non-Hispanic white population, which I think is important when assessing these results. So they said in 30% of student coding, the victim indicated they were positive by things like, she was happy, my friend was grateful. In 30%, there was a negative response by a perpetrator. He was mad. The male did not react very well. I'm using these responses, quotes directly from the article. And then the stop behavior, in 13%, things like he backed off, they listened. So I think that this measurement strategy is actually really innovative, because this is what we want, right? It's kind of secondary intervention because things have already started. But if we're actually stopping a behavior, that's like, I stopped a sexual assault. Like, this is kind of a meat and potatoes for current immediate impact, which is really positive. And the nuance to that last quote, the subject proceeded to find a different girl to dance with, you know, is a little tragic, because it reminds me of risk reduction. It reminds me of a lot of old school child sexual abuse prevention, where, you know, if we're not lifting everyone together, we're leaving some people more vulnerable. And is that really prevention, or is it just like diffusing to the more vulnerable people out there? So something to consider as a limitation to bystander intervention in certain contexts. This study also, when people mention the 5 Ds, this is why I knew it, asked, do victims and perpetrators seem to respond differently based on the strategy used? So they have a lot of interesting findings, and I could spend 10 minutes talking about them. So if you want to learn more, I highly recommend you check out this article. The title's on the top. But they found that direct interventions elicited or led to more positive responses by both victims and perpetrators. And the reason I wanted to highlight this finding is I was sort of surprised by it. You know, a direct intervention is like, I'm coming right up to you and saying, hey, that's not cool. Hey, I'd like you to stop. hey, I'm worried that this person is going to hurt you and we need to get out of here. That, you know, victims in encoded articles where someone used a strategy like that, victims responded positively 41% of the time, compared to any other strategy where it was almost half that at 22. Now, we're not going to jump up and down because perpetrators generally don't like to be stopped in what they're doing, but in 12 to 13% of the time, they actually indicated a positive response compared to all other responses where it was only 1%. The authors talk a lot about what might be going on, you know, maybe situations where people feel safer using direct responses are just more likely to lead to more positive outcomes because they feel safe enough to do that in the first place. But regardless, I think it's an interesting finding. And it was also something we found a lot when coding our own data on an upcoming study. So if you want to learn more about measurement, I'm going to introduce you to someone who's going to talk about coding, but I did a short little blurb with NSBRC, great organization, and you can click there. I know that was kind of a part of this training, but we skipped over some of it to make sure we could get to other things as well. And with that being said, I'm really excited to introduce Tajamel Yassine. I did a study with him and Katie and Sarah, and the greatest thing is I'm not going to talk about it myself because you should not let PhD students talk about their own research. We will never stop talking about it. So luckily they're gonna step in and do that, and he is going to talk about a qualitative coding experience, which I think is very practical for some of you out there who might be looking at this as an approach. With that, take it away.
Thank you so much, Rose. And I had a wonderful opportunity to be part of this crucial and important study, given sexual violence and racism is a critical public health concern. I was a part of a team of 4 wonderful people from diverse educational and social backgrounds, and we all brought our own experience on the board. As Rose told, that I will very briefly share my coding and data experience with you that would help you to get a better understanding of the whole coding process specifically, and in general the measurement of this thing. The coding team analyzed descriptions of students, intended and actual interventions in 9 different bystander scenarios. For example, if there is a scenario that if someone is drunk or someone is trying to physically harass or use any derogatory comments about someone, how the bystander interact and how the bystander react or help the person. So we used Microsoft Excel with all brief open-ended responses to the bystander intention, and bystander behavior questions were coded by us. By coding, I mean we assigned themes. For example, if a person says, I help the victim to get home, we coded it as help victim. Or if the person says, I called the police to get the victim out of the situation, so that we coded as that get help professional. So that is how we coded that, and I will share you some examples that would help you to understand it in a better way. In addition, we used to meet weekly to revise our codes, to review our codes. One concern when you do thematic analysis is the method we use to assess the student responses is that it might not be trustworthy because each person may assign different codes to the same data. To take this into account, we tested inter-rater reliability using a statistic that assesses how well a group of people code together. Our results indicated that we averaged moderate to good reliability, which is really good actually. So coming to, if you can turn to slide number 50, there are some examples. Yeah, so it's already here. Okay, so if at the top, let's take the first example. So the bystander intervener, he said, I will actively intervene and how they explained it in the comment that they will help them home if they're a friend or find someone nearby that can help. So the strategy it was quoted by the coders was get help other, because they are saying they'll find a friend to get a help, or help victim. And the detail, that was a medium level detail, and it was supportive towards the victim rather than the perpetrator. If you go to the second line, it says save the person. It does not give any detail. It's a low detail, but it was coded because they're saving the person, so at least they're helping the victim, and it is again supportive towards the victim. uh, Sharing one other, so one said, I will actively intervene, but the comment this year is that create a distraction to take my friend in a safe place, finding a false excuse so that the person leaves my friend. So that is, they created a distraction to help or support the victim, or to take the victim out of the situation. There were some like I will stare at them. I will use my hands to say stop. So for example, if the third last, if you go to third line, I said they will use the body language, and this just wrote stare. So that means the strategy we coded was body language, and the detail is the anything that they're like physically doing or something, we coded as medium, and that was again supportive towards the victim. There were some times where they were there were people with bystander that they will say, actually they will talk to the perpetrator or say something to them. For example, if you go to the second last, uh, so the bystander said, hey, they said, no dude, back off, it's cool if they don't want to drink more. So that's like assertive towards the perpetrator, and how they wanted to, they said disapproval, and they shared it with a high level of detail. With that, that was a brief peeping into the data we had, and how we all the group of 4 researchers coded it. As a researcher myself, I have experience of working on various projects which include qualitative analysis, but my experience on this particular project was unique. I really appreciate and like this method of analysis, since we were able to assess over 1,000 responses of people, and also with much depth and scrutiny. Uh, Overall, I love the whole experience, and I think I will actually encourage the use of this methodology. And why would so? Just for instance, alternatively, we could have connected focus groups or interviews with a bunch of people. But I'm sure, and I can bet on it, that that we would not have been able to differentiate student responses to 9 different real life examples as we have here. So we have like small vignettes, 9 different situations where the bystander can interact or react with the perpetrator or the victim. And here we are also able to do the pre and post evaluation of the bystander program, small scenarios, people responses, and then coding each of the line, and on top of it, meeting the interreliability criteria, make it very unique and powerful. And in the end, if you like to learn more about our results, I recommend you check out a session we will be delivering online at American Public Health Association conference this fall. And that is it. Thank you.
Thank you, Tajamal. Thank you, Rose, for all of that super great research knowledge that you all shared. I really like that we ended on talking about qualitative methods. I feel like that gives folks an opportunity to hear the stories of bystander intervention and prevention from others, and see what themes, what codes come out of that. You know, and make meaning of numbers. That's the way that I always think of it. So we want to quickly ask you all, before we move into talking about a practitioner perspective, what findings from the recent research on bystander intervention can you incorporate into your bystander intervention practices? So please head over to the text chat and answer that question. Ashley just pasted it into the text chat too. And while you are thinking about how you can apply that research, I want to invite Katie and Sarah back to the conversation to talk about this researcher practitioner partnership. So Katie, Sarah, hello, welcome back. So let's start off and tell us about why you decided to partner with Rose on bystander intervention research.
Yes, hi Tori, thank you. So I knew Rose in her previous role at the State Coalition Against Sexual Assault. So she knew a little bit about the kinds of prevention education that we were doing at Marquette. So on campus, we have, Sarah's going to talk a little bit about it. We have kind of a number of different touch points for students. And because of that, Rose approached us about doing some sort of research. So initially we kind of were in this, what could this look like? And eventually landed on bystander intervention in the type that we ended up evaluating. So with juniors and seniors, covering alcohol, sexual violence, and incidents of racism. So it took us a long time to get there, and really found a path forward that was what Rose wanted to study, and also was something that we could really benefit from in terms of informing our programming moving forward.
That's awesome. So you had just mentioned that you focused on juniors and senior students. Why did you choose that focus?
Hello everyone, this is Sarah, and we chose to focus on juniors and seniors. Katie and I work collaboratively to provide prevention education around a variety of health and wellness topics at our institution, and we saw a need to incorporate training for our juniors and seniors. In our model of health education, we provide mandatory Red Watch Band training, which is a bystander intervention training to address alcohol and to provide help to individuals who may have suffered acute intoxication. And we also provide bringing in the bystander, which I know I saw in the chat box a number of other institutions and organizations utilize, which is a sexual violence-based prevention program out of the Prevention Innovation Research Center at the University of New Hampshire. And so we already had two mandatory bystander intervention programs within our overall health and wellness plan. And so we saw a need to really focus on ongoing training and ongoing practice in reference to some of the research Rose shared about the need for ongoing messaging and continued messaging around bystander behaviors. We really wanted to fill a gap that we saw with our juniors and seniors. And so creating a program that was specific to our population, really focused on addressing ongoing education on alcohol and other drugs, and then including racism was really important to us.
Mm-hmm. That ongoing education is so important. So we know that you focused on multiple topics, including sexual assault, alcohol, and racism. What was behind that decision to focus on all of those topics in bystander intervention?
So we really wanted to build upon what the students had already been learning, but also we know these issues don't occur in a vacuum. So thinking about how can we give them skills to address all sorts of situations that they may be encountering, particularly as we're thinking about our juniors and seniors, they're going to be transitioning a lot of them into the working world or into internships or co-ops where they're in different kind of scenarios outside of the college campus setting, which is previous bystander intervention programs that they had received really focus on that college campus setting. So we're really thinking about how can we prepare them with these skills that, again, focus on all of these different areas, especially when we know that on our campus, we don't have the kind of bystander intervention around racist incidents that they don't have that comprehensive education that they do for alcohol and sexual violence. So we really wanted to find a way that we can make it more intersectional.
That's really great. And that's so important to to encourage folks to intervene in all forms of violence and harm, especially intervening in instances of racism too. Would you consider the strategy of combining alcohol, sexual assault, and racism outcomes in the work that you do with upper level students moving forward?
Yes, with our study with Rose, we were really fortunate to be able to use the data that Tajamal referenced and the work that Rose referenced in the theory. And so moving forward, our plan is to continue to scaffold and build on the training that we offer our underclass students, and then to build specifically when we're looking at addressing racism in our juniors and seniors. It is something that we noticed we had significant gaps both in our co-curricular and our curricular experiences at our institutions. So we really see a need to specifically continue ongoing racism education, specifically related to bystander intervention, and then to build on the progress we have made around alcohol and sexual violence.
That's so great, because then your anti-racist students become anti-racist graduates who then become anti-racist adults in workplaces, or raise anti-racist children. So can you share more about some of the successes and challenges you experienced during your research partnership?
Yeah, I'm going to try and be as concise as possible because we learned a lot from our experience. One of the things I will just start out with is that Rose is amazing, and just from our partnership with her, we learned a lot about current trends, all of the research that she talked about today. I think that was one of, honestly, the most valuable things about the partnership. So that was a huge success. We learned a lot. It also was a level of accountability for us in terms of really thinking about how are we evaluating our programming, and are we making sure that we are focusing on being effective. And just that level of accountability is something that those of you who are practitioners on the call understand, that you focus a lot on getting that program out and there's not as much time for evaluation. So that also was a success, is getting some of that feedback from Rose about our program, about our students, and just being able to have that inform our programming moving forward. Another success was getting our peer educators, who were the ones that facilitated this program, getting them excited about research and really being able to inform them about all that's going on in this field. Finally, some of the challenges. Our plan was not our reality, which is something that happens probably a lot in research, but we just had to be flexible, and we're constantly adjusting. So getting students to engage was sometimes a challenge, and we kind of had to have multiple phases of rolling out the program because of that. It wasn't as much of a challenge, but I think sometimes institutional red tape can be an issue. So I'm thinking particularly about IRB and getting approval to do the research, that kind of thing. It went relatively smoothly for us, but I think that could be a challenge.
Thank you for sharing all of those. What did you learn from the evaluation that was helpful for you, and how will those results impact your work moving forward?
I just wanted to reiterate our thanks to both Rose and her coding team in working with us, and really what we learned, some of the major takeaways for Katie and I as we prepare to deliver bystander intervention training in the future, and to specifically continue to deliver programming to our juniors and seniors, is that we really need to look at our engagement phrases that we offer in our program. And so for folks on the call that are familiar with the Step Up program, there are a number of bystander engagement phrases that are offered in that program and that are utilized in other programs across the country. And what we found from the research that Rose conducted was that our students were not using or identifying the engagement phrases that were offered in our evaluation and in our program. Our students were stepping in and offering help and intervening in situations, but they weren't familiar with the language that we were using. So we will need to change our engagement phrases to meet the current student population, which we view as a really positive piece that we learned from the evaluation, and that we need to look at how our language and what we are using helps our students to kind of navigate bystander-based situations. We also learned that we really need to focus on self-efficacy skills. So helping our students just see the role that they play in a variety of situations, both direct and indirectly. And then finally, we've alluded to this in some of our prior comments, but we really need to focus on what our curriculum looks like as far as how we are delivering our content around addressing racism, and really needing to address racism through our Bystander program in both our campus community and then, as Tori said, training our students to go out into the world and address racism on a daily basis.
I love adaptive evaluation or learning from your evaluation. And I want to lift up something that Kira Lynn said in the text chat. So Kira Lynn said, I just want to highlight that anti-racism and bystander intervention shouldn't just be about what do you do if you see racism, but about delivering the sexual assault focused stuff in an anti-racist way. Even if your focus is 100% about sexual assault, street harassment, etc., it has to be anti-racist. Otherwise, we are over-suspecting men of color, under-protecting Black girls and women, etc. So I think that's so important to bring into this conversation. It sounds like that's something that you all are exploring in your programs too, about making sure you're doing both and. So last question, 2 parts. What is one piece of advice you would give to practitioners looking to engage in research? And what is one piece of advice you would give to researchers looking to partner with practitioners in research?
Yeah, I'll probably tag team with Sarah on this a little bit. She may have something she wants to add, but I also appreciate what Carolyn said, and just want to say that that's one of the reasons why we push to combine some of these issues, is that we know that there's so much overlap, and that's something that we are continuing to push toward: holistic health education and prevention education on our campus, rather than these like siloed topic specific curriculum. So anyhow, flexibility is what I will say for practitioners is, if you have a researcher approach you and they are interested in partnering with you, just being flexible. And that is flexibility in potentially adapting your program, who you are presenting your program to, how you present your program. Those kinds of things are all really important when we're thinking about particularly the trying to maintain the integrity of research. So being flexible and also recognizing the value of someone approaching you to do research. Sarah and I have often talked about how we on a campus are surrounded by folks who are doing research, some of them in this area, and yet they're not really doing it with the programming that's happening on our campus. So it's so valuable when a researcher is approaching you and wants to do that research specifically on the bystander intervention that you're implementing. So that's for practitioners. For researchers, I will say, please reach out to practitioners. Recognize that one of the things I really appreciated about Rose is that she recognized how busy we are at different times of the year, and she was just as flexible, if not more, than as we were. So I just really appreciated that about Rose, her understanding of as practitioners, particularly if we're working in an educational setting, there are ebbs and flows, and we are still working within the structure of a system. So that comes with a lot of challenges. So I guess flexibility for both and enthusiasm was always really helpful when we partnered. Sarah, I don't know if you have anything to add to that. You may not.
I will add, I accidentally forgot to unmute myself for a moment, but I will add that I really appreciate the opportunity within the practitioner researcher relationship to continue to involve students. So at Marquette University, we are primarily an undergraduate based institution with some representation at the graduate level, but I really see the value in continuing to foster the future of practitioner-researcher relationships. So as Tajamal stated, we were able to utilize a number of coders on our team, some of them undergraduate students. So really looking to foster the future of both prevention work on our end as practitioners and foster the future of research. So I would say if you can involve students, it is really, really important.
Great. Thank you both so much. There is a question about what is a good way for practitioners to open their doors to researchers. So how can practitioners be proactive in seeking relationships with researchers?
Yeah, I think developing relationships with folks at higher ed institutions, particularly some of the folks that you might see. I think Rose might have some ideas about this, but thinking about some of the folks that you see on some of these studies that really speak to what you're wanting to know about your work, and reaching out to those folks and trying to develop a relationship and just letting them know, hey, I have a population and people here that I want to have some insight into. So Rose, you might have some insights too.
Thanks so much, Katie. I will say, I think it's just really hard. You know, lots of research and practice are isolated, but I think it's like critically problematic in this field. The number of studies that I see seem to be sort of happening in a vacuum by researchers themselves, not in collaboration. Not to say that's always the case, but I think it's really hard for practitioners. One good way to do that is just show up where researchers are. So if you get an opportunity to go to a more research-focused conference, that can be a really great way to connect with someone. Obviously, in your own institution, finding out who's doing, if you're on a college or you're in a community that has a campus, you know, is there someone who's currently working on this kind of stuff? Even that can be very difficult, but it could be a great intern project. Like, hey, intern at our agency, like we want you to cruise, you know, local university websites for researchers who do sexual violence work, and maybe we can even get a team of folks together. Another thing about researchers is that they tend to be very grant and study driven. So if they're like busy right now, it might be very hard for them to add something on. Not that much different than grant funded nonprofits either, I suppose. But regardless, reaching out and forming that relationship, you know, even like Katie said, like we met in a different context and it was like, I don't want to think about how many years later that then the study happened afterwards. So that initial relationship building and being in shared spaces, I think is the greatest starting point. But I do think it's really hard and it shouldn't have to be this hard. And hopefully we can, you know, as communities come up with better ways to connect.
I would just like to add something. As a researcher, as a student myself, one of the hindrances as the researcher faces is getting the data or collecting the data. If the practitioner researcher can collaborate on some kind of a grant, or if they can get a grant, where they can work together, where researchers are bringing up their research experience and experimental kind of thing, the practitioner can help them to connect and with a number of clients or people or the other resources. So if they collaborate that way, that can be one way of translating the research into strategies and interventions. Thank you.
Thank you all for your responses to that. It sounds like you all have given folks a lot to think about with, you know, what their researcher practitioner partnerships could look like. Folks are asking for recommended conferences that they can attend to meet researchers. So if our presenters wouldn't mind responding to that in the text chat if they have recommendations. I also understand that you all will be presenting on this collaboration at the APHA virtual conference. So we provided a link to the to that in the text chat. So we have a few minutes left. We want to ask our audience, what will it take to strengthen collaborations between researchers and practitioners? And as you all are responding to that in the text chat, I want to take, and I know it's a lot to ask for 3 minutes, but I want to ask our presenters, while folks are thinking about what it will take to strengthen collaborations and answering that in the text chat, I want to give you all an opportunity to talk about what's the future of bystander intervention? What do you see happening with bystander intervention and the impacts of COVID-19?
Yeah, I can speak just a little bit about what we're thinking about for our campus moving forward, and with the huge caveat that we don't even really know what things will look like in the fall, because everything seems to be changing day by day. But we're thinking about shifting to a virtual format for our bystander intervention curriculum, and really focusing on how can we leverage bystander intervention skills to help promote safety around everything related to COVID-19. So thinking about holding each other accountable for social distancing and wearing masks, and how can we try and create a culture around that, just as we have around other types of behaviors. So that's kind of where we're at right now, but we are kind of in this unknown place, just as I'm sure a lot of the folks on the call are.
I would also reference the great resources that Rose provided with the online modules that have been developed or are being developed. Katie and I are both looking at how to implement that virtual or online learning, as Katie referenced. So I think a great resource for us moving forward.
Great. Thank you for that. I also felt like the online resources and the text message resources were really so valuable to hear about, especially right now, as you know, it depends where people are in the country and in the world, how that's going to look for them in the next month or so. And I want to take a moment to thank everybody for the awesome conversations that are happening in the text chat. You all will receive a copy of the text chat when it's available in the coming weeks. And this web conference is also being recorded. So just want to thank you all for all of the great conversations that you're having. Ashley just repasted the links to a couple of those online interventions, our online prevention programs for bystander intervention, if you all want to look at those. And with our last 2 minutes, we want to uplift some resources for you all too, in addition to the content and conversation that you all have shared in the chat today. So again, if you want to learn more about measuring bystander intervention, check out Rose's podcast with NSVRC on measurement. It's a quick 10-minute listen, all about measurement. PreventConnect did a web conference about 3 years ago, also examining bystander intervention research for sexual and intimate partner violence prevention. That is available on our website as well. I'm seeing a question about, it would be great to get a copy of the PowerPoint. A copy is available on our website right now. And a link is in the earlier parts of the text chat, but a link was also emailed to you before the web conference today. Yes, thank you all so much for being here today. Thank you for your contributions. Thank you to all of our presenters for sharing their research, their practice, their wisdom, their insights. Thank you to our audience for having such a lively and rich and fulfilling text chat. It was really wonderful to follow along and read all of that and be able to uplift you all. I want to thank my co-host, Ashley Klein-Jimenez, for keeping up with all of the links and resources and for her support today. And I want to thank our colleagues at Aberdeen Captioning for providing closed captioning. Thank you all. We look forward to seeing you on future PreventConnect web conferences. And this concludes today's web conference. Please take care.